Welcome to the Healthy Aging webinar series. Today we'll be discussing evidence-based health promotion programming and Title III funding. My name is Jen Teague and I work with the Division of Aging and Adult Services as the Evidence-Based Health Promotion Coordinator for the state of North Carolina. Some of our topics for today will include Title III funding, examples of evidence-based health promotion programming, some of the benefits associated with evidence-based health promotion programming, an introduction to the new Healthy Aging NC Resource Center, steps on how to implement some of the programming, and any requirements that you must complete after completing a workshop. Additionally, we will discuss our plans and vision for the future. But first, we'll talk a little bit about some of the history of 3D funding. Title III was established in 1987 through the Older Americans Act. The Older Americans Act was signed into law in 1965. The Older Americans Act is designed for individuals over the age of 60 to have access to services. When Title III came out in 1987, it was specifically designed for evidence-based health promotion and disease prevention services. This funding is specifically to support education and implementation of activities that support the healthy lifestyles and promote the healthy behaviors among adults age 60 and over. In 2012, there was a change to the way that the funding can be used, and congressional appropriations began to require that all 3D funding be used only for programs which are demonstrated to be evidence-based. And then again in 2016, AOA, the Administration on Aging, implemented a highest tier level of programs which were allowed to be used with 3D funding. Following the change in the law in 2016, the North Carolina Division of Aging and Adult Services came up with a set of health standards and policies to assist AAAs in implementing 3D programming. Below, you'll see the link for the service and standards policies. So for something to be deemed evidence-based health promotion programming, it has to be demonstrated through evaluation to be effective for improving the health and well-being or reducing disease, disability, or injury among older adults. In addition, it's been proven effective with the older adult population. It has research results that have been published in a peer-reviewed journal, and is fully translated in one or more community sites, and also includes developed dissemination products that are available to the public. Here are a list of a few of the evidence-based health promotion programming that are offered here in North Carolina. Falls prevention programming, specifically a matter of balance, Tai Chi for arthritis, and Walk with Ease. In addition, there are chronic disease self-management education programs that are available. These can also be referred to as the Stanford suite of programs. These include chronic disease self-management, or in North Carolina, we call it Living Healthy, diabetes self-management, chronic pain self-management, the Spanish version of the chronic disease self-management program, positive self-management program, along with additional other programs that are available. In addition to the falls and chronic disease, we also have powerful tools for caregivers, home meds, GeriFit, the Arthritis Foundation exercise programs, Fit and Strong, and numerous others. The link below will take you to a list of the full highest 3D tier programs that are available here in North Carolina. The AAAs have the ability to implement any of the programs that are listed on the chart. So now we'll talk a little bit about some of the benefits of evidence-based programming. They have proven return on investment. They improve the health of older adults. It allows us to offer new classes in our community. It also expands any classes that may be offered for scope. It attracts additional funding and new members to senior centers and parks and rec programs. We have an infrastructure in place to support each other across North Carolina if we implement evidence-based health promotion programming. And above all, they're proven to be the best programs at achieving outcomes. Some of the measurable outcomes that we have are increased public and stakeholder awareness of programs and services, increased organizational capacity to provide evidence-based programs and services, increased healthcare provider knowledge of falls and falls risk, the clinical community partnerships to establish referral systems, along with older adults and adults with disabilities, they will increase self-efficacy. The clinical and community partnerships part is something that we're really working on in our vision for the future, and there will be future webinars that will be discussing some of the additional ways to work within your clinical community. Some of the partners that we have providing evidence-based health promotion here in North Carolina are the 16 area agencies on aging, senior centers, parks and recreations, YMCAs, the UNC school systems, federally qualified health centers, the CCNCs of North Carolina, communities of faith, and regional falls prevention coalitions, along with the Division of Public Health, the Office on Disability and Health, and the Office on Minority Health and Health Disparities. So you can see we have a lot of partners at the table doing this important work. Now I want to take just a minute to talk to you a little bit about the NC Center of Health and Wellness at UNC Asheville. And to do that, we need to give you a little bit of history. The Division of Aging and Adult Services has for numerous years been applying for and receiving ACL grants. Based on the ACL grant that the division received in 2014, a statewide website and resource center was created. This had been the vision from the Division of Aging and Adult Services for numerous years. The idea was that we can be bigger than the aging network. When the resource center was originally created, it was being referred to as the hub. We've now changed the name to the Healthy Aging NC Resource Center, and this has allowed for expanded services to individuals all across the state. Primarily, the Healthy Aging NC Resource Center will focus on falls prevention and CDSME. There will be additional webinars that will talk to you more specifically about the staff and the programs that they have available. The link below will take you to a website where you can learn more about their programs and the resources that they have available. This is a picture of some of the staff that work with the Healthy Aging NC Resource Center. Nicole Miller, unfortunately, is not pictured, but she's the Director of State and Community Collaborations. Jeannie is the Project Manager and oversees CDSME programs. Aiden is the Project Manager and oversees falls prevention. And Janice is the Data Administrator. And Janice's role is one that you will often get to know, as she's the one who inputs all of the data that you will be gathering once a class is complete, and it is sent to her. So when implementing evidence-based health promotion program, we get a lot of questions as to how do you implement it, what does it look like, how does each region offer the programs in their counties. And so each one is different, but the way that it works is that the state will provide the 3D funding to the AAAs, which are to be used specifically for evidence-based programming. The AAA can then choose to keep the money and provide the workshops in-house, as in they have a staff person that will go out there and do that, or they can choose to give the money to their provider network. There are benefits to keeping the money in-house as well as dispersing money out to the provider network. Many AAAs have made the decision to talk with their providers to see what was going to be best within their region and within their communities. If the AAA chooses to keep the money, they are essentially responsible for offering the workshops throughout the region. And if the AAA chooses to disperse the money, they will monitor the funds and will ensure that programs and workshops are being offered. Each AAA is then responsible for sending in a quarterly report to the 3D coordinator for the state. This report provides a quick overview of the numbers of programs offered, participants attended, and number of leaders. The reporting for evidence-based health promotion workshops to be sent to the Healthy Aging NC Resource Center is specific to chronic disease self-management, a matter of balance, and Tai Chi for arthritis. The information that's to be sent to the Healthy Aging NC Resource Center is the cover sheets, attendance logs, and participant information surveys after a class has been completed. Those forms can either be scanned and sent to the email listed or can be mailed to the mailing address that's listed there with attention to Janice. You may be wondering, how can you become an evidence-based health promotion trained instructor? Maybe one of the classes I mentioned earlier was something that you were really interested in or think would be really good for your region or your county or community. There are requirements for each of the programs, each of the evidence-based programs to be implemented. So you would need to become a trained instructor. Based on the program in the class, there are different requirements. So for some, leaders are required for each workshop. Some require 2, some only require 1. And there are set time frames and information that has to be provided. In addition, there are set time frames for how long the class must go, how long each session must be, and so on. The NCOA chart will list all 3D programs available and also list all requirements for becoming trained in each program. In regards to a matter of balance and chronic disease self-management education programs, there are master trainers and lay leader trainers. And if you have questions The Division of Aging and Adult Services and/or the Resource Center can assist you with answering additional questions on how to be trained in each program. So now we'll briefly take a look at our future plans and some of our visions. So we hope to be implementing webinars, and hopefully we will have additional trainings in the future that talk more specifically on how to become trained in a certain program, the benefits of offering certain evidence-based programs, and what's involved in each of the programs that are available throughout the state. In addition, we'll have regional meetings, the Healthy Aging Summit. We'll be reaching out to senior centers, partnerships with the YMCAs, outreach to our medical providers, coalition building. We hope to begin work on Medicare reimbursements, business planning, and online training. So you can see we have a lot planned for our future. Our future looks bright. I always like to end my presentations with a quote and a final thought. I am only one, but I am one. I cannot do everything, but I can do something, and I will not let what I cannot do interfere with what I can do. Edward Hale. And so as we have said, there's a lot of programs that are available to be offered in the state of North Carolina, and maybe you don't implement them all, but you can implement one. So thank you for your time. This is our contact information. We'd be happy to answer any questions or comments that you may have. You can either choose to call us or give us an email. Thank you so much and have a good day.